Hello friends, कैसे हैं आप? Very good evening to all. So hope all is well. So friends, when I was discussing with the students, I realized that the difficult part of the subject community medicine, what they feel is numerical aspect. And what they say, मैम न्यूमेरिकल्स के नाम से डर लगता है, और आपको तो पता है हमारा मैथ्स वीक है, इसीलिए तो हमने बायो लिया. And that is the point where idea clicked in my mind that I should take a separate session exclusively focusing on numerical aspects. So friends, very good evening, Shreya, very good evening to all. I hope all is well. सब ठीक ठाक चल रहा है? Great. So this session is exclusively on the numerical aspect. Now here I had included all possible numericals from the subject community medicine. The questions I had divided into 9 segments, 9 topics, and after that mostly which I had analyzed from previous year questions, 5 areas from where questions are commonly asked, that is epidemiology, screening, biostats, demographic, contraception and prevention in pediatric and obstetric. Now in this session, we will be learning that how to approach for a question if it is asked in the exam, because now they are giving us a digital calculator. So we'll be using that calculator. We have to read the question quickly, just recall the formula, what they are asking, try to find the values in the given scenario, put the values in that formula and getting your correct answer. And the beauty of this is that we should be doing all this exercise without using rough paper and pen with our mental calculation. So we have to develop this habit for mental calculation. Okay. So without wasting time, we'll be starting the first topic, the numericals which are commonly being asked is from epidemiology. So read the question carefully and try to answer those questions. Now first is calculate relative risk in the given cohort study. So the first thing which should flash in your mind is that what is the formula for relative risk? They are asking us the relative risk. And relative risk, we know that relative risk is calculated as, it is a risk ratio, means it is a ratio of incidence in exposed divided by incidence in non-exposed. Okay? So I am writing here, but this you have to just scroll in your mind. Now the next point is that we have to see that what is the incidence in exposed and non-exposed. So exposure here is what? The exposure here is, that is the coffee intake, and non-exposed is without the coffee intake, and the coffee intake person is developing pancreatitis. This is the outcome. Now how many are the total individuals who are exposed? 150 plus 850, that is the 1000 are the total individuals, and out of the 1000, 150 are developing the pancreatitis. This is what is the incidence in exposed, that is a 150 per 1000, and incidence in non-exposed is, it is a 50 per pancreatitis, and 850 is not having pancreatitis. So again, out of the total 1000, we are having the 50. Now here the straightforward, we know that as the total number of the cases and the control are same, exposed and non-exposed, so directly we can take as a proportion 150 by 50 means 3 times it is more in the coffee intake possibility of pancreatitis. But yahan pe remember one point, suppose here the total number of the individuals are not same as in the coffee intake or without the coffee intake. Suppose in the coffee intake they are saying it is a total 1000, and after that the 150 is having the pancreatitis. But imagine this, I am telling you the twist in the question, that imagine suppose this non-coffee intake, the figure might be 50 plus it is 1950, suppose, imagine. So the total individuals will be 2000. Now here we cannot take a proportion as 150 to 50. Now we have to convert first out of this 1000. So the cases of pancreatitis out of the 1000 will be 25 only. And then with the 25 we have to take the risk ratio or relative risk. Okay? So this is the might be a twist in the question, but it is not there. So a simple, the answer for this is, let me just check your answers also. So yes, you all are answering correct. Yes, you all are started answering quite correct. And in this question, the relative risk is none other than 3. Very good. So just you have to just clap for yourself that you all are answering quite correct. Okay? Now coming to second question is, in an epidemiological study, it was confirmed that gastroenteritis cases were 5 times higher in rainy season in comparison to the other season. Calculate attributable risk. Okay? So same here. The first thing is that we have to see what they are trying to ask. They are trying to ask the attributable risk. The second point, you have to just recall the formula of attributable risk is, it is the risk difference. Means a difference in the incidence in exposed minus incidence in non-exposed divided by incidence in exposed. This is what is the formula. Now see, they had simply mentioned that it is 5 times higher in the rainy season in comparison to the non-rainy season. So rainy season kya hua? It is an exposed, and non-rainy season it is non-exposed. Suppose imagine कि non-rainy season में if I say the 10 cases, any presumptive value you can take. So suppose if I take the 10 cases in the non-rainy season, so 5 times higher will be in the rainy season. So 50, suppose it is in the exposed individuals, minus if it is 10, it is the non-exposed. This is the imaginary I am taking, or you can take as a 5x minus x, whatever you want, and it is divided by 50. Okay? 5 times है, so it is 5 times of the non-exposed, and this will be your 40 by 50, and it is coming as 0.8. अब यहाँ पे the catch is, if you see the choices, that is 0.8 is not a percentage. अगर आप 0.8 को percentage में convert करोगे, so yes, it will be your 80%. So yes, again you all are answering quite correct. A big clap for all of you, that it is your 80% is attributable risk. Okay? In an epidemiological study, it was confirmed that malaria and the dengue cases were 50 per 1000 population in rainy season, while in the other season it is 10 per 1000 only due to the improper sewage disposal. Calculate population attributable risk. Now यहाँ पे population attributable risk, again you have to first recall your formula for population attributable risk, and the population attributable risk formula is, it is your incidence in total minus incidence in non-exposed divided by incidence in total. अब यहाँ पे incidence in non-exposed दिया है, it is 10 per 1000, incidence in exposed दिया है, it is 50 per 1000. अब यहाँ पे there is a one important catch. Important catch क्या है? That it will, beta, those who are answering 80%, beta, you all are answering as the attributable risk. ठीक है? अब यहाँ पे incidence in total निकालने के लिए the first step will be, how many cases are in the exposed? 50 are in the exposed. How many are in the non-exposed? It is 10. So total cases कितने हो गए? 60 हो गए. Out of the how much of the population? That is 10,000 non-exposed हैं, 1000 exposed हैं. So it will be, that is 2000. ठीक है? So convert into the single unit as per 1000. So it will be 30 per 1000 population. ठीक है? 30 per 1000 population, it is your incidence in total. ठीक है? ये बेटा इंपॉर्टेंट है, जो मैंने फर्स्ट आपको रिलेटिव रिस्क में बोला था ना कि सपोज अगर यूनिट्स आपके अलग अलग हैं, एक पर 1000 में दिया है, 2000 में दिया है, तो आपको 1000 में कन्वर्ट करना है. यू हैव टू कन्वर्ट इनटू अ सिंगल यूनिफॉर्म यूनिट. सो यहाँ पे इंसिडेंस इन टोटल विल बी 30 per 1000, नॉट the 50 per 1000 or not the 60 per 1000. ठीक है? So अब यहाँ पे क्या है? The formula is, incidence in total is your 30 per 1000, non-exposed it is your 10 divided by incidence in total, it is 30, and it is your 20 by 30 coming as it is 0.66, or it will be your 66%. 66%. ठीक है? How to interpret the data of RR, AR and PAR, like how to tell in the statement. Okay, beta, if I have to tell in the statement, the relative risk is said that how much time there is a increased possibility of development of the disease in the exposed individuals in comparison to the non-exposed, or the exposed individuals are at risk of how much times of having a higher possibility of the disease, that is a relative risk. ठीक है? What is the interpretation of an attributable risk is, suppose there is an 80% of attributable risk is coming in this situation. So 80% the cases of, जो हमारा पहला क्वेश्चन था, 80% cases of the gastroenteritis are related to the rainy season. Okay, so this is means how much is the contribution of the risk factor in the causation of that particular disease. It is your attributable risk. Now, what is the population attributable risk is that if we are removing the risk factor, how much there is a possibility of reduction in the disease in the community. It is what is a population attributable risk. Now, यहाँ पे एक कीवर्ड हमेशा याद रखना कि in a question the population attributable risk will always be less than the attributable risk. Suppose if I say that in this rainy season the diarrhea cases or the rainy season is responsible for 80% of the cases, it means in 20% of the cases the gastroenteritis is happening without rainy season. So some other factors are working. So if we remove the rainy season, it will not causing a reduction up to 80%. That is, some cases will be happening because of the other reason also. So population attributable risk will be always less than the attributable risk. ये हमेशा एक शॉर्टकट फॉर्मूला दिमाग में याद रखना है. ठीक है बेटा? हिंदी में बेटा अगर मैं कहूं कि रिलेटिव रिस्क का मतलब है कि एक्सपोज इंडिविजुअल्स में कितने हायर टाइम चांसेस हैं डिसीज डेवलप होने के इन कंपैरिजन टू नॉन एक्सपोज. एट्रीब्यूटेबल रिस्क का मतलब है, एट्रीब्यूशन होता है कंट्रीब्यूशन, मतलब वो रिस्क फैक्टर कितना रिस्पॉन्सिबल है वो डिसीज कॉज करने के लिए. ठीक है, कि 80% केसेस में रेनी सीजन रिस्पॉन्सिबल है डिसीज करने के लिए. पॉपुलेशन एट्रीब्यूटेबल रिस्क का मतलब होता है कि अगर आप वो रिस्क फैक्टर हटाएंगे तो कितना रिडक्शन पॉसिबल है. अगर ज्यादा रिडक्शन पॉसिबल होता है तभी गवर्नमेंट उसके लिए लॉ बनाती है कि मैंडेटरी होगा कि वो आपको प्रोटेक्शन लेना पड़ेगा. ठीक है बेटा? सो आई होप दिस इज क्लियर. So example, if the statement, I think now all the queries are clear for all of you. So the correct answer for population attributable risk will be, it is 66%. ठीक है? अब यहाँ पे कैलकुलेशन का जो है वो ध्यान रखना, एंड पैरेलल जैसे कि if I say that this is what is your a digital calculator is also available on your display. So I try to open the calculator also wherever we will be needing. Suppose 20 by 30 है आपको, तो आपको जो है अगर डाउट है, so what you can be doing that simply you have to divide 20 by 30 and what you will be getting is 0.66. So 0.66 is not a 0.66 percentage. अगर इसको percentage में convert करेंगे so it will be 66%. ठीक है? So like this you will be using your digital calculator wherever you are requiring. ठीक है? For example, like if an AR of a lung cancer and the smoking is 10, this means that the 10% of the lung cancer are due to smoking. स्टेटमेंट सही है क्या? AR ऑफ अ लंग कैंसर इन द स्मोकिंग इज 10. बेटा AR कभी भी जो है वो राउंड फिगर में या तो पॉइंट्स में आएगा लेस देन 1, और अगर उसको परसेंटेज में कन्वर्ट करेंगे तो वो percentage होगा. So the statement will be that AR of a lung cancer in the smoking will be, if it is 10%, then it means then the 10% of the lung cancer cases are due to smoking. ठीक है? So it will not be 10, it will be the 10%. ठीक है बेटा? Now coming to the next question in epidemiology, what is asked is that calculate the odds ratio. ठीक है? अब यहाँ पे the table is given and sometimes the table is not given in their question, then it become a little bit difficult. Now, if the table is given, so quickly what you have to do, you have to just recall the 2 by 2 table in your brain, and looking at this is that one is an disease present, disease absent, and in the this is in the vertical column, and in the horizontal column what it is that is risk factor present or risk factor absent. Okay, and we know that this is what the disease is present and the risk factor is also present, so it is your true positive, it means it is your A, and this is your false positive, that is B, it is your false negative C, and it is your true negative D. And we know what the formula for odds ratio is, it is your AD upon BC. Okay, AD upon BC, and you all had started answering very correctly, that is AD upon BC. So it is 20 into 95 divided by 80 into 5. Okay, so if you had a doubt, you can use your calculator here, and if I am just removing myself, switching off the camera for a few seconds just for your clear understanding, and if I say I have to calculate with the digital calculator, so it is 20 into 95, which is divided by 400, and this will be coming as 4.75. Okay, so you all had started answering quite correct, and here this is why we can be using our calculator, because कभी कभी choices में बहुत क्लोज डिफरेंस आता है, ठीक है, तो उसमें जो जीरोस होते हैं उनका बहुत ध्यान से आपको जो है वो देखना पड़ता है, बिकॉज इट माइट बी सपोज 0.475 भी इफ इट इज इन अ चॉइस देन इट मे बी अ कंफ्यूजिंग थिंग, ठीक है, सो हियर द करेक्ट आंसर इज 4.75. सो सी कि अभी तक हमने जितने क्वेश्चंस देखे, the thing is that you have to just see in the numerical what they are asking, quickly recall the formula, put the values in the formula and get the correct answer. Now the next is, in a population of 10,000, the total reported death in 2021 were 500. The deaths due to accident like this, COVID this, the cancer is this, calculate the proportional mortality rate. Okay, so the first step is what they are trying to ask is proportional mortality rate for COVID disease. Okay, so quickly recall the formula of proportional mortality rate is, that is death due to the specific disease. What they are asking is the COVID ke liye. So how many deaths are because of the COVID? The COVID deaths are 350. Now here the catch is that what you will be putting in the denominator. ठीक है, अब आप वर्ड को अगर ब्रेक करोगे, proportional mortality means out of the total deaths, how many deaths because of the COVID. So denominator में you will not be taking the total population. This is a one very important point. So what you will be taking is, you will be taking as 500 in the denominator, ठीक है, and यहाँ पे multiplying factor is 100 because it is although a rate but it is expressed in the percentage. This is again a very important catch, it will not be 1,000, ठीक है. So now the 00 gone and this is your 70%, ठीक है, so it will not be your 7% and it will be your 70%, and yes, you all had started answering quite correct, it is your 70%. So see what mistake you can do. अगर आपने 10,000 if you are taking as a denominator, ठीक है, 10,000 if you are taking as a denominator and expressing as per 100, you might be getting your answer as 3.5%. That is a wrong statement. If you are expressing as per 1,000, taking 10,000 as a denominator, you might be having the 35%. That is also a wrong statement, ठीक है, also a wrong statement. So be very careful. अगर आपने जरा सा भी जीरो के कैलकुलेशन में गड़बड़ कर दिया, you might be getting as a 7%. This is also a wrong statement. So be very careful about this, and we are going to choose a correct answer. So correct answer for this is, it is 70%, and yes, so be very careful. The proportional mortality rate में the denominator will be your total deaths because of all causes, ठीक है. क्रूड डेथ रेट में क्या है, डिनोमिनेटर विल बी द टोटल मिड ईयर पॉपुलेशन. केस फैटालिटी रेट में क्या है, केस फैटालिटी रेट में द डिनोमिनेटर विल बी द टोटल केसेस, एंड टोटल केसेस में से हाउ मेनी डेथ्स आर हैपनिंग. सो दीज आर द थ्री mortality rates with the three different denominators, ठीक है. तो याद रखना, बिकॉज क्वेश्चंस आर आस्क्ड फ्रॉम दीज थ्री आल्सो. So during 1 year follow-up study, a psychiatrist tried to find out the societal tendency among the 100 patients with drug addiction. 7 patients had the previous history of the suicidal tendency and 20 patients developed it for the first time. Calculate the incidence of the suicidal tendency in this study population. ठीक है, so यहाँ पे what they are trying to ask is, it is the incidence. Now what we know the incidence is, it is defined as the new cases per thousand population at risk. ठीक है, this is what is the definition of the incidence. Now कितने patients हैं? 100 patients हैं जो drug addiction के हैं. Already 7 is having a suicidal tendency. This is a very important catch. तो एक बार अगर suicidal tendency है तो दोबारा थोड़ी होगी, उसमें तो already है. So risk में कितने बचे? So risk population is, it is 93 only. This is the first important catch. First important catch. ठीक है. So beta, those who are answering as B, be very careful that यहाँ पे total is 100, but the 7 is already having the suicidal tendency. So at risk population कितनी है? 93. Now I have to calculate the incidence from this risk population, and how many are new cases? The new cases are appearing as 20. ठीक है, new cases are appearing as 20 and it is from the risk population as 93. ठीक है, अब see the question, they had asked me in the choices are given as a percentage. ठीक है, normally incidence का definition क्या है? It is per 1000, but they had given me in the choices are in percentage, so I have to convert into 100. ठीक है, so एक आपको यहाँ पे एक जस्ट अगर आप मेंटल कैलकुलेशन करोगे कि अगर 93 की जगह 100 होता तो 20% है, अब 100 से थोड़ा सा कम है तो ये वैल्यू 20 से थोड़ा सा ज्यादा होगी. ठीक है, तो विदाउट कैलकुलेशन आई कैन से दैट माय आंसर विल बी 21.5%. बट यस, लेट मी चेक इट बिकॉज कोई भी कंफ्यूजन नहीं होना चाहिए. सो आई एम जस्ट अगेन just switching off the camera for few seconds so you can be just seeing the proper calculation. And if I say that it is 20 divided by 93 and this is coming as 0.2215, means if you have to convert into percentage, so it will be your 21.5%. ठीक है, 21.5%. ठीक है, so I hope now it is clear to you. अगर suppose इस question में ये नहीं कहते कि 7 patients are already having a history of the suicidal tendency, then directly your answer will be the 20% or 20% or we can say the 200 per 1000 population. But यहाँ पे 7 is already having the suicidal tendency, so you have to minus from the total population to get the population at risk. Remember, yeah, ये चीज याद रखना. ठीक है बेटा. In a study among the 3,400 children aged 5 to 10 years, the 17 were diagnosed with the autistic disorders. The calculate the prevalence of the autism per 1,000 children. अब normally prevalence क्या कहते हैं? That is the total cases per 100 population. ठीक है, अब क्या है यहाँ पे per 1000 में उन्होंने पूछा तो I have to answer in per 1000. ये हमेशा question में याद रखना, कभी वो per 1000 में पूछते हैं, कभी वो per 100 में पूछते हैं. अब how many are the children with the autistic disorder? 17, and 17 जो है out of how much of the population? It is out of the 3,400 population. ठीक है, so they had asked at a prevalence at a point and I have to convert into 1000. ठीक है, क्योंकि उन्होंने 1000 में पूछा है. अब यहाँ पे 0 को याद रखना, it is 2, 0 is gone, so it is 10 upon 2 and this will be coming as 5. अब यहाँ पे the very important catch is that this 5 is not a 5%. 5% नहीं है. क्यों? क्योंकि this is per 1000 population है. So my answer will be 5 per 1000 population. ठीक है बेटा, it will not be a 5%. 5% तो तब होता जब अगर ये है कि मेरे को 1000 की जगह अगर 100 में कन्वर्ट करना होता, so that will be a 0.5% actually. ठीक है, 0.5% is same as 5 per 1000. अब यहीं पे थोड़ा सा जो है वो ट्रिकी हो जाता है. And if you see the previous year questions, they had asked the choices like this only, and that's why intentionally I had put the choices like this. ठीक है, कि 0.5% भी है and 5/1000 भी है, ठीक है, दोनों सेम है, लेकिन चूंकि दे हैड आस्क्ड इन 1000, so my answer is it is 5/1000. But suppose they didn't mention it, they simply say the calculate the prevalence. So the best is way to calculate the prevalence in 100 and then my answer will be 0.5%. ठीक है? So I hope you got this point. I repeat this point. If they simply ask the calculate the prevalence, then the first prevalence is calculated is per 100 percentage because it is a proportion. But यहाँ पे they had asked us specifically per 1000. So I have to express in 1000. 1000 में जब आप एक्सप्रेस करेंगे it will not be a percentage. ठीक है, तो ये छोटे छोटे पॉइंट्स हैं which we have to remember. ठीक है. So yes beta, you all are answering quite correct. Bhavi, user, and the smooth, you all had answered very correct. Paridhi, that it is 5/1000 population. ठीक है बेटा. Now, last 5-year survey of the diarrhea report says that mean incidence of diarrhea cases is 100 per 10,000 population with a standard deviation of 10 cases. In the recent season, the high diarrhea cases were reported to label this as an epidemic. Number of the diarrhea cases per 10,000 population should be. ठीक है, अब यहाँ पे simply they had asked the definition of the epidemic. ठीक है, अब उसको उन्होंने एक न्यूमेरिकल के फॉर्म में कन्वर्ट कर दिया. And here quickly we have to recall what is an endemic, epidemic, pandemic, and the sporadic. Endemic means the cases are happening within normal limits, and we know what the normal limit is. That is, it is mean plus 2 SD. That is what is a normal limit. And we know the what is epidemic if the cases are beyond the normal limit, and what is a beyond the normal limit is that if it is more than mean plus 2 SD, it is what is called as an epidemic. Pandemic matlab epidemic is happening across the borders, international borders, then it is a pandemic, and the few scattered cases are, that is sporadic. अब यहाँ पे epidemic पूछा है. Epidemic means the cases must be more than mean plus 2 standard deviation. ठीक है, अब यहाँ पे standard deviation कितना है? Standard deviation is 10. So actually they had clubbed this the statistic with the epidemiology, and what is a normal diarrhea mean cases is it is 100. So 100 plus 2 standard deviation means double over 10 means 20. So it is 100 plus 20. It should be more than 120, because more than 120 hoga, then it is beyond the normal limit, and then we'll say it is an epidemic. And yes, you all had started answering correct also, that it is option D, it is your correct answer. Okay, so see, simple definition of epidemic they had converted into a numerical. So यहाँ पे एक बहुत basic फंडा याद रखना, in community medicine any small definition can be beautifully converted into a numerical. तो numerical के लिए आपको कोई बहुत ज़्यादा जो है परेशान होने का जरूरत नहीं है. Simple thing is, कोई rocket science नहीं है. Simple thing is that you should be thorough with the various definitions and the formulas and their concept. ठीक है? And easily you can answer your numericals. So these are the numericals related from the topic epidemiology. And I am getting daily lots of messages from all of you कि मैडम पढ़ते हैं भूल जाते हैं, एग्जाम के टाइम में याद आएगा कि नहीं आएगा, whether we'll be able to remember what we are studying on the day of examination. We were not able to focus yesterday I was upset, my health was not good, I was having some problem, because I can understand the weather is not good, it is uncomfortable in the North India at present, but still whatever has gone yesterday, you cannot just revert back the clock. But जो हो गया, कल नहीं पढ़ पाए कोई बात नहीं, ठीक है, उसको सोचने की जरूरत नहीं है. बिकॉज ऑफ दैट थॉट यू आर नॉट गोइंग टू स्पॉइल योर टुडे. ठीक है, जो हो गया लेट इट गो, यू हैव टू फोकस ऑन करेक्ट थिंग. स्टिल अगर मैं बात करूं फॉर द FMG एग्जाम, दिस इज around 70 days still with us, and in these 70 days we can do miracles, we can revise our content quickly, even twice we can revise in these 17 days. ठीक है. Now coming to your questions related to screening. Now screening के जो questions हैं, they are little difficult to solve विदाउट पेपर एंड पेन, ठीक है। पेपर एंड पेन के साथ में तो इजिली आप 2x2 टेबल बना के सॉल्व कर सकते हैं, लेकिन विदाउट पेपर एंड पेन we have to make the table in the brain and then you have to do the calculation. So it might take a little bit, a few more seconds, more of a concentration to get your answer. ठीक है. Now see this question. The total population of 1000 was assessed for diabetes. The disease prevalence calculated as 20%. A new screening test was applied on the this is whatever the long story. Just see what is asked. They are trying to ask calculate the negative predictive value. तो सबसे पहले जो long question है देख लो क्या पूछ रहा है. Negative predictive value. Now quickly recall the formula of negative predictive value. We know it is negative predictive value, all negative, what we had discussed in a quick way to remember the formula of the negative predictive value. All negative, true negative in the numerator divided by true negative plus false negative. ठीक है, this is my formula. अब मेरे को दो values चाहिए, true negative and false negative. Now see, the total population is 1000 and the disease prevalence is 20%. ठीक है, so I am making the table here, but this table we have to smartly make in our brain. ठीक है, अब यहाँ पे क्या है, जो disease population है 20% है. Imagine 1000 total population है, so my disease cases are 200 and remaining my 800 will be the healthy population. This is my first step. ठीक है, अब क्या कह रहा है वो, a new screening test was applied on the same group with a sensitivity of 80% and specificity of 90%. अब मेरे को क्या चाहिए, I need a two values, that is I need a C value and the D value to get my negative predictive value. ठीक है, क्योंकि C क्या है मेरा false negative है, D क्या है मेरा true negative है. I'm not bothered about the A and B. I want these two. How I can get these two? Sensitivity is 80%. So 80 sensitivity क्या है? Ability of the test to correctly detect the disease. So out of the 200, 80% of this 200 means 160 are true positive. So 20% will be the true negative. So this is my C value I got as 40. Little bit difficult of the screening, but yes, we should be able to learn how to solve. Now, what is the specificity? It is the 90%. 90% of this 800 are true negative. So it is 720 will be true negative and remaining 10%, 80 is your false positive. Now I got my C and D. So my negative predictive value, it is your 720, that is true negative, upon that is true negative plus false negative. So 720 upon 760. ठीक है, 720 upon 760 and here I'll be using the calculator because yes, might be a little difficult. I'm just again switching off my camera for a few seconds. So it is your 720 divided by 760 and your answer is, it is 94.947 or we can say it is your, just a minute, yes. So the correct answer for this is, it is 95%. ठीक है, so yes, it is a little bit a difficult sort of numerical without the rough paper and pen. As I say, epidemiology के easily हो जाते हैं, statistic के हो जाते हैं, screening में थोड़ा सा problem होती है, but still I know that you students are quite intelligent and you will be doing each and every type of numerical. This is, I'm very sure. Okay, as you all had started answering quite correct, and a big clap for all of you that it is 95%. Now coming to the next is, screening test was applied on 1000 individuals where 100 were truly having the disease. This question I had taken from a recent May में जो INESET exam हुआ था. INESET exam में this was the question asked and that's why I had taken this question from there. Screening test was applied on 1000 individuals where the 10 were truly having the disease. Again, a big bala questions. So just see what they are trying to ask. They are trying to ask is positive predictive value. ठीक है. Again, recall the formula. So first step is see what they are trying to ask. ठीक है. Positive predictive value, again, a quick catch for formula, all positive. So it is your true positive divided by true positive plus false positive. ठीक है. अब ठीक है, अब मेरे को two figures चाहिए, true positive and false positive. Screening test is applied on the 1000 individuals, total 1000 say, and 100 were truly having the disease. A new test is correctly identifying the 90 as a positive. ठीक है, अब आपको टेबल ना भी बनाए, so out of the 100 disease cases, how many are truly detected as 90? So my true positive value is 90. This is the first in this statement. But additional 50 were also positive without the disease. तो उन्होंने straight forward कह दिया. What is my false positive? False positive is 50. ठीक है, तो मेरे को टेबल बनाने की जरूरत ही नहीं है. एंड दिस इज हाउ ब्यूटिफुली दे शुड गिव द क्वेश्चन कि दे नो भाई हमारे पास में पेपर नहीं है, पेन नहीं है, सो वी शुड बी एबल टू फाइंड आउट द फिगर फ्रॉम द क्वेश्चन इटसेल्फ. एंड यहाँ पे ब्यूटिफुली स्टेटमेंट में ही दिया. सो दे हैड गिवन अस अ ट्रू पॉजिटिव एंड द फॉल्स पॉजिटिव. अब कोई कंफ्यूजन ही नहीं है. आई एम हैविंग अ वैल्यू एज ट्रू पॉजिटिव 90 एंड द 90 plus 50, that is 90 upon 140. 90 upon 140, and again we will be using our calculator. So I'm just switching off my camera for a few seconds, and this is your 90 divided by 140, that is equal to 64.62642, or we can say it is your 64%. ठीक है, so you all had started answering quite correct. A big clap for all of you, and it is none other than your 64%. ठीक है. Now coming to, so the correct answer for here is, just a minute, I think my pencil is not responding. Just give me a second. Everything is fine. Yes. So correct answer for this is 64%. ठीक है बेटा? Now coming to next is again a screening question. A new screening test is able to correctly detect 90% of the cases. Again, alabalas in the question. So see, calculate the sensitivity and the specificity. ठीक है? तो sensitivity भी पूछ रहे हैं, specificity भी पूछ रहे हैं. अब sensitivity का formula क्या है? We know the sensitivity is equal to true positive upon true positive plus false negative. और अगर formula में कहे ability of a test to correctly detect a disease. And what is your specificity? It is true negative upon opposite true negative plus false positive. Ability of a test to correctly exclude the disease. ठीक है. अब read the question. A new screening test is able to correctly detect 90 out of the 200 known disease cases from the community. ठीक है. And able to exclude from having the 80 among the 100 healthy individuals. अब स्टेटमेंट में ही आपकी डेफिनेशन और आंसर छिपाए. सेंसिटिविटी क्या है? एबिलिटी ऑफ अ टेस्ट टू करेक्टली डिटेक्ट द डिसीज. कितने केसेस को डिटेक्ट कर रहा है? 90 डिटेक्ट कर रहा है. एंड यहाँ पे अ वेरी वेरी इंपॉर्टेंट कैच इज दैट इज आउट ऑफ द 200 केसेस. ठीक है, अगर आपने 200 केसेस नहीं कहा तो क्विकली व्हाट यू थिंक दैट सेंसिटिविटी इज 90%. नो, 90 out of the 200 to 100 में कितना होगा? 45. This is the catch here. So your sensitivity will be, first they are asking sensitivity, so it is your 45%. So only one option is this. अब मैं अगर specificity calculate ना भी करूं, if I'm not going to calculate the specificity, my answer is correct because it is a method of exclusion when only one choice is for 45%. So obviously my specificity will be 80% because it is able to exclude the 80 among the 100 healthy individuals. ठीक है, so my correct answer is option C. तो यहाँ पे the catch is only that 90 जो है ये disease cases हैं, this is out of 200 disease individual. This is only the catch कि आपको trap क्या दिया है कि sensitivity should not be 90%. ठीक है बेटा? So these are the questions related from a screening, and I can see a big golden rule for clearing your exam, any of the exam, is multiple revision. Multiple revision. ठीक है? Revision, multiple revision you have to do. And आपको revision करते समय ऐसा लगेगा कि you are not able to recall, but still you are making your visual memory. When you see the question on your computer screen, you will be remembering. ठीक है? Believe in your hard work. अपने हार्ड वर्क पे बिलीव करो एंड डेफिनेटली यू विल विन दिस बैटल. The next is biostatistic. Biostatistic में again some numericals are asked. In a normal distribution pattern with the mean value as 150 with a standard deviation of 10, a very commonly asked question, multiple times this type of question is asked is calculate the range of 95% of the population. So 95% population मतलब क्या है? How much of the standard deviation it is covering? It is standard deviation is it is plus minus of the 2 SD. ठीक है? क्योंकि 68% plus minus of 1 SD, 95% plus minus of the 2 SD. And very simple question, how much is the mean value? 150. How much is the standard deviation? Is 10. So twice of this 10 less means 150 ka 20 less and 20 plus. 20 less or 20 plus. So what will be your answer? It is your 130 to 170. And already you all have started answering quite correct. So a big clap for all of you. It is 130 to 170 will be the range. Okay? So many times this type of the question is asked from us in the exam. Calculate the mean value for given data set. Calculate the mean value for given data set. अब यहाँ पे mean means the average of all the values. अब यहाँ पे if you quickly see that is 2, 2, 3, 3, 4, 4, 5, 5, 6 मतलब डबल वैल्यूज हैं, ठीक है, एंड डबल वैल्यूज हैं तो टोटल 2, 4, 6, 8 टोटल 10 वैल्यूज हैं. अब यहाँ पे there is the two ways to do the calculation. अब यहाँ पे या तो मैं 2 + 2, 3 + 2, 4 + 4, 5 + 5 करूं, ठीक है, मेरे को थोड़ा सा टाइम ज्यादा लगेगा, और आई कैन जस्ट एड अप एज 2 + 3 + 4 + 5 + 6, ठीक है, मैंने ऐड कर दिया, दिस इज माय 20, ये हाफ है, इसको मैंने डबल कर दिया, मल्टीप्लाई बाय ट्वाइस, दिस बिकम माय 40, एंड इसको आई हैड डिवाइडेड बाय द टोटल वैल्यूज एज द 10, सो माय मीन वैल्यू इज कमिंग एज 4. ठीक है, तो ये तो एक है आपको टाइम सेव करने के लिए, बिकॉज अगर आप सेकेंड वे क्या करोगे, यू कैन जस्ट एड अप 2 + 2 + 3 + 3. अब आपको कई बार कंफ्यूजन हो सकता है कि आपने ऐड करा कि नहीं करा है, हो सकता है यहाँ पे तो दिख रहा है आपको, कंप्यूटर स्क्रीन पे ना दिखे, लाइक +4 + 4, आप इतना टाइम क्यों वेस्ट करें, ठीक है, आप इस तरह से भी कर सकते हैं, यू जस्ट गेट योर आंसर एज 40. ठीक है, अब इसको आपने 10 से डिवाइड कर दिया. सो सिंपल मीन इज मींस यू हैव टू take an average of all the values, and yes, you all had started answering quite correct. That is, mean value is your 4. Now coming to next is calculate the median for given a data set. Now median क्या है, means you have to arrange the values in the ascending or the descending order, and the middle value if it is an odd number, and average of middle value if it is an even number, then that is your median. अब यहाँ पे क्या values दिया है, 5 values दिया है, odd number है. If I arrange into an ascending order, so smallest one is 10, then 12, it is 26, 29 and 48. ठीक है, so directly middle one क्या है, it is 26 will be my median value. So 26 will be my median value. So this will be your median. ठीक है, तो यहाँ पे आपको क्या समझना है कि what is your the definition of the median, that you have to arrange in ascending and descending order, and the middle one is your median value. ठीक है, now coming to so yes, you all are answering quite correct, that is option B, 26 is your median. Now coffee intake of 6 members of the family per day is 2, 2, 5, 3, 4, 3. Calculate the mode. A mode का we know that what is mode is a most frequently occurring value. अब यहाँ पे tie है, that is 2, 2 and 3, 3. ठीक है, अब यहाँ पे we had already discussed कि if more than one values are sharing the same frequency, so there are the two ways to write the mode. Either you can write an actual value 2 and 3, or you can take an average of those values as 2.5. ठीक है, अब इन दोनों में से भी if you have to choose one which is better, actual value is better, so now I have to see the choices कि दोनों values दी हैं या खाली 2.5 दिया है. So 2.5, yes, this could be a mode also. 3, it is not the mode. 2, it is not the mode. 2 and 3, yes, it could be mode. अब आपके पास में दोनों ऑप्शन है बेटा, ठीक है. अब यहाँ पे बेटा those who are answering as A, listen carefully, कि जब दोनों हैं आपके पास में 2.5 भी एंड 2 and 3 भी है, तो एक्चुअल वैल्यू इज प्रेफर्ड देन द एवरेज वैल्यू. रिमेंबर दिस पॉइंट. सो यहाँ पे द बेटर आंसर विल बी 2 and 3, that is not a 2.5. ठीक है, अगर 2.5 2 and 3 नहीं दिया होता, then you should have gone for 2.5. But अगर 2.5 and 2 and 3 both है, then you have to choose a actual value. Remember this point. ठीक है. Identify the type of the given data. Now, just try to see this question. It's a concept based in a form of numerical. अब यहाँ पे क्या है, a data set is given and you have to just say whether it's a normal distribution, positive skewed or negative skewed. अब वैसे तो बड़ा डिफिकल्ट है, आपको लगेगा यार भाई ये तो मैडम ने तो कोई ऐसा फॉर्मूला बताया ही नहीं, how I can identify the positive skewed, negative skewed or the normal distribution pattern. ठीक है, अब यहाँ पे क्या है, आपको कॉन्सेप्ट ये देखना है कि व्हाट इज द रिलेशनशिप ऑफ द मीन, मीडियन एंड मोड इन द नॉर्मल, पॉजिटिव एंड द नेगेटिव. नॉर्मल में ऑल थ्री आर सेम, पॉजिटिव में मीन इज मैक्सिमम, नेगेटिव में द मोड इज मैक्सिमम. सो नाउ यू हैव टू कैलकुलेट द मीन, मीडियन एंड मोड फॉर दीज फिगर्स एंड देन गेट योर आंसर. ठीक है, 2, 4, 3, 4, 5 and 6. ठीक है, although we had discussed the same in a previous question to calculate the mean value, but still we will be trying to see again. ठीक है, अब mean अगर मैं बाद में निकालूं, what I can get as a first is median. Median is, it is the middle value. So what is your coming as the median? Median value is coming as 4. What is your mode? ठीक है, mode is the most commonly occurring value. All are having the same frequency, 2, 3, 4, 5 and 6. So if I have to take an average of all this 2, 3, 4, 5, 6, my mode will be coming as 4. And the mean is also coming as 4. So all three are same, mean, mode and median. So what will be my distribution pattern? So yes, Paridhi has already started answering, and the others, Vijay and the Om Prakash, you all are answering very correct, that mean is equal to median to the mode. So what will be this type of the distribution pattern? It is your normal distribution pattern. ठीक है? So it is your normal distribution pattern. While doing a calculation for a given number, by mistake the number 5 is written as 35. The correct statement is, अब क्या numbers हैं आपके? Numbers are 5, 25, 10, 15 and 45. And see the choices, mean is changing or the median is changing. Obviously, any number if it is written by mistake another number, the mean तो change होना ही है. ठीक है, mean तो definitely change होना है. So look at the choices, mean will change, yes, and mean will change. This any one of these two choices. Mean will not change, mean will not change, this is out. Now I have to see whether the median will change or not. Now median के लिए क्या है, that we have to find out the middle value. Now my figures are 5. So if I am arranging in an ascending order, the 5, ठीक है, then it is 10, 15, 25 and 45. ठीक है बेटा. So there is a tie between the option C and option A. The maximum of you are answering the option C. ठीक है बेटा. Now just listen carefully. The Vijay has answered correct. A big clap for you, Vijay. Because यहाँ पे just see बेटा, this is a type of the PYQ was asked from us in our previous exam. But यहाँ पे see, in place of 5, what it is written is 35. So 5 की जगह पे what it is written is 35. So 35 will be coming somewhere here. अगर 5 था, तो what was my median? Median was 15. But now this is not the median because now it is 35. So my median will now become as 25. So median change हुआ है यहाँ पे. तो यहाँ पे again a golden rule याद रखना. If a smallest value, listen carefully. अगर small, पहले मैं हिंदी में बोलूंगी, smallest value से नीचे हो जाएगा. 5 की जगह अगर 2 लिखा होता तो मीडियन चेंज नहीं होता. हाईएस्ट वैल्यू से और ज्यादा होगा तो मीडियन चेंज नहीं होगा. 45 की जगह 95 होता तो मीडियन चेंज नहीं होता. लेकिन अगर स्मॉलेस्ट वैल्यू से ज्यादा है या हाईएस्ट वैल्यू से कम है तो आपका मीडियन चेंज होगा. नाउ आई रिपीट इन इंग्लिश दैट mean will change in every situation. But if a value is a smallest number is becoming more smaller or the highest value is becoming more higher, median will not change. But if a smallest value is becoming higher or the higher value is becoming lower, your median will change. So यहाँ पे what is happening? The 5 is being replaced by 35. So the lowest number is becoming a higher number. So median will change. ठीक है? And that's why this is not a correct answer. Option C. The option A is your correct answer. The mean will change and median will also change. ठीक है? जो PYQ था PYQ में था because highest number का और highest हो गया था. That's why the median was not changed. This was the PYQ. So again, it's a very important take home message here is you have to go through PYQs but never ever mug up the answers for the questions. If there's a little change in the question, your answer will change and this will make you in a big trouble. Okay? What if the 45 becomes 30? 45 becomes 30, then definitely the median will also change because highest value is becoming lesser one, then median will change. But agar 45 is becoming as 95, then median will not change. I hope this is clear to you now, beta. Which percentile is equivalent to a second quartile? Very simple question. I hope you all can answer. ठीक है, तो PYQs का कभी भी आंसर मगअप नहीं करना. So which percentile is equivalent to second quartile? We know that second quartile means a quartile distribution, matlab 4 equal parts. So 4 equal parts means the first quartile, it is 25th percentile. The second quartile, it is your 50th percentile. The third quartile, it is your 75th percentile. So yes, you all are quite correct. No beta, that is Dhanush beta, it is not a 25. Okay, it is not a 25 because the second quartile, it is equivalent to 50th percentile. 50% is below, 50% is above, and that is what is a 50th percentile. Okay, and Big Nawab, why you are putting a question mark on a B? You are a correct, having a correct answer. Okay, so it is your 50th percentile is a correct answer. Among the 200 children, weight cutoff is at a first quartile is 30 kg and the third quartile is 50 kg. Calculate the interquartile range. Okay, so again, this is the concept is same. This is your first quartile. This is your second quartile. It is your third quartile. The first quartile is what? It is 30 kg. The third quartile is, it is your 50 kg. And interquartile range is, it is a difference between the first and the third quartile. So it is 50 minus 30, that is, it is your 20 kgs. Okay, so interquartile range is, it is quartile 3 minus quartile 1 and that is 20 kg. Okay, so your the answer is option number D. ठीक है, option number D. But the 30 to 50 is the interquartile range जो बोलते हैं, it is actually the difference between the third and the first quartile. ठीक है, थर्ड एंड द फर्स्ट क्वार्टाइल के बीच का जो डिफरेंस है उसको इंटरक्वार्टाइल रेंज बोलते हैं. यहाँ पे वो जो रेंज वाला डेफिनेशन है वो नहीं आता है. इट इज नॉट अ 30 to 50 कि दोनों के बीच का जो डिफरेंस है, अगर 20 नहीं है किसी कारण से, इफ 20 इज नॉट इन योर चॉइस, देन यू कैन गो विथ 30 to 50. बट अगर 30 to 50 एंड 20 में यू हैव टू चूज एन आंसर, बेस्ट ऑप्शन, सो डी इज प्रेफर्ड ओवर द सी. D is preferred over C. ठीक है, so the first preference is given to your 20 kgs. ठीक है बेटा. Now coming to the next is, in the NEET UG entrance exam 2025, the 20 lakh students appears. The marks of a student is at the 90th percentile. Calculate the percentage of the students having mark above this student. ठीक है, so very again important concept. The 90th percentile means that 90% are having below and 10% is having above. A simple concept based question. So they are asking how many students are having the marks above. अब यहाँ पे दो चीजें हैं. See in the question whether they are asking the percentage of the students or they are asking the actual number of the students. If they are asking percentage, then your answer will be the 10%. But if they are asking the number of the students, okay? So number of the student means the 10% of how much is the total? How much is the total is 2 lakhs. So number अगर पूछ रहे हैं, so 10% of the 2 lakhs means 20,000. Sorry, 20 lakh hai. So 10% of the 20 lakh means the 2 lakh will be having above, but they are asking percentage. So percentage kya hua? 10%. So here the correct answer will be your 10%. Okay, so question mein zarur dekh lena, they are asking the percentage or they are asking the actual number. Okay, beta. So again Dhanush beta, you had answered as the number of the students. So number नहीं है बेटा, 2 lakh नहीं पूछ रहे हैं, number नहीं पूछ रहे हैं, percentage पूछ रहे हैं. The same is with the Ankit also beta, and the same is that Ankit beta, it is not the C because they are not asking the correct this actual number. Actual number होगा तो 2 lakh होगा, percentage होगा तो 10% होगा. तो question में ध्यान दे लेना. The mean hemoglobin of a population of 100 is a 10 gram person with a standard deviation of 1 gram. Calculate the standard error of mean in this situation. So again the formula of standard error is calculated as standard deviation divided by square root of sample size. Okay, and how much is the standard deviation here is? Standard deviation is 1. What is the sample size? Sample size is 100. You have to take a square root of 100, so 1 upon 10, and that is coming as 0.1. Okay, so 0.1. So again the concept is that you should remember the formula for the standard error, and it is your standard deviation divided by square root of the sample size. अब यहाँ पे जीरो का खेल है, ठीक है. अगर जरा सा भी जो है change हो गया, so you might be getting a wrong answer. So your correct answer is option number A. Beta Ankit, you are asking that how many questions are expected from these 25 questions. Beta, what we can say that the questions, if you are talking about the 25 most important question series or you are asking about the numericals, I'll answer both of them. ठीक है, numericals में से today we'll be covering almost around 57 numericals, covering almost each and every aspect possible numericals from the subject, and the numerical count is varying from 1 to 5. ठीक है, depending upon the examiner choice. And if you are asking about the 25 most important question series, I can say that copy paste of the question may or may not be there, but yes, out of those 25 topics, I can say around 50 to 70% topics में से questions are definitely going to come. ठीक है, so that's why we say that we are more concerned about the important topics, not about the important questions. The mean weight of students in an area is 65 kg with a standard deviation of 5 kg. Calculate the relative weight of Mr. X with the 80 kg weight and comment if it is normal or abnormal. ठीक है, I think numerical कितने होंगे? I had already answered because it may range from 1 to 5. Like last exam में 1 numerical was asked from a Pearl index. उससे पहले 3 numericals पूछे थे, उससे पहले में 4 numericals पूछे थे. ठीक है, because they had started now giving a digital calculator, तो थोड़े से number of questions ज़्यादा पूछ लेते हैं. अब यहाँ पे what they are trying to ask is a relative deviate. अब formula क्या है relative deviate का? Relative deviate, it is also known as a Z-score, and it is that is x minus x bar divided by standard deviation. ठीक है, x means actual value for which you have to calculate the deviation, x bar is the mean value. You have to just calculate the deviation of a student with the weight of 80 kg. What is the mean weight? Mean weight is 65. So it is 80 minus 65. What is a standard deviation? Standard deviation is, it is 5. So it is your 15 divided by 5, and that is plus 3. So you already had started answering quite correct. It is plus 3. We know that a value within plus minus of the 2 standard deviation is normal. So it is plus 3, and it is definitely an abnormal value. Now study was conducted to see association of air pollution with allergic pharyngitis and alveolitis, and the result is given in this image below. That's the correct statement about the correlation coefficient. अब यहाँ पे they are trying to ask the correlation coefficient. अब correlation coefficient का calculation formula, it is quite difficult, but यहाँ पे we will be getting a cut short way how to get an answer. Now, first you should be knowing that what is correlation coefficient. It is a degree of association between the two parameters. Second is by which graph we can calculate, it is by the scatter diagram. Third is what is the range. It is ranging from the -1 to +1. Okay. Now, what we do is that we plot the values on the x and the y axis, and these dot dot are the values, and we make an imaginary line. Okay. अब यहाँ पे अगर suppose imaginary line is like this, that all the values are coming on the same line, it is in a positive direction, so यहाँ पे correlation coefficient will be +1. If it is in an opposite direction, means if you are increasing the one parameter, the second is decreasing, and all the values are on this line, it means it is -1. Now, more is the deviation of the values, the lesser will be the value. ठीक है. अब यहाँ पे क्या है, look at this, the values are not on this imaginary line, they are scattered, so it is obviously not a +1 or -1. And now this imaginary line is increasing, going towards a positive side, so it cannot be a -1. Okay, so this is a one concept. So minus is out, it cannot be a -5.5, it cannot be -1. And it cannot be +1 because exactly it is dots are not on a imaginary line. So 1 is also out. So only the option left is 0.5, maybe 0.6 also, it may be 0.4 also. Exact calculation we cannot say. So beta, it will not be a +1. ठीक है, +1 में all the imaginary lines will be on the same, this dots will be on the same line. ठीक है, so it will be your 0.5, and obviously it is towards a plus side. It's a little bit a difficult one. Now, this type of the question has not been asked from us in the FMGs, but yes, it has already been asked in INSET exam, and that's why I thought I should be including that. I'm very sure that my all students should be able to answer the question. ठीक है. Now, explain once again, beta. ये जो है, this is a scatter diagram, and what we do, we just put the values. Suppose this is showing a relationship between the allergic pharyngitis and alveolitis in the air pollution. So on the x-axis we will have a the air pollution value. The more is the air pollution value, the higher is the chances of having a allergic pharyngitis and alveolitis. तो जितने भी values आते हैं, they are representing in the form of the dots, and we make an imaginary line. If it is going towards an upper side, means you increase the air pollution, then the cases will increase. It means that is having a positive association. And if it is going in an opposite side, it means it is having a negative association. Now, if all the dots are on an imaginary line, this is a exact highest association, maybe a -1 or maybe a +1. Okay, but if it is scattered like in this, it is not on the dots on an imaginary line, it is scattered on the upper on the lower side, so it is somewhere between a 0 to +1 because it is towards a positive side. Range क्या है, -1 to +1. हमने देखा था ना कि अगर 0 वैल्यू आती है, no association, 0 to +1 positive association, 0 to -1 negative association. So the value is somewhere between a 0 to +1. It is not a +1, it is not a 0. So choices में क्या है, only option left is, it is not a 1, 1, it is a 0.5. So obviously it is not towards a minus side, so it is towards a plus side. Okay, so this is how smartly you have to get your answer. Positive association is related to increasing the risk for disease. What the risk factor which is shown in this question? The risk factor is your air pollution, and air pollution से allergic pharyngitis cases are increasing. तो जरूरी नहीं है कि every allergic pharyngitis case is because of the air pollution. It can be because of the other factors also. ठीक है? That's why it is not a +1. अगर every case is related to air pollution only, no other reason for allergic pharyngitis, then we can get an answer as +1. But यहाँ पे other factors भी हो सकते हैं. ठीक है ना? Why abnormal in the last question बेटा? Last question में abnormal इसलिए था because जो normal range होती है, it is within a plus minus of the 2 of the mean value. अगर related David value is coming within plus minus of the 2, then it is normal. अगर beyond 2 है तो वो abnormal है. ठीक है? ये golden rule है, that is the statistic, any value within a plus minus of the 2 SD is normal, but beyond अगर होता है तो abnormal है. ठीक है बेटा? Missed of all, 25 most important questions for the subject videos are important to watch before the FMGs. I think beta, if you are not seen once, you should go with that questions. But rather than what topics has been covered in those the questions, that topics you must revise. I know you all are doing studies, might be having some the problems which is not common for all of us. It may be there some individual problems also, but we have to ignore those problems because your goal is bigger than what problems you are facing. ठीक है? तो problems को blame करने का कोई फायदा नहीं है. You have to focus your goal, focus on your studies, and your goal is that is 28th June. You have to give your best performance in the exam. The next topic is demography and contraception. Again, a very commonly asked area from where questions are asked is country with a population of 10,000. The reported live birth in the last year is 180 and the death is 65. Calculate the crude birth rate and crude death rate. Again, the first is you should be knowing the definition of the crude birth rate. Crude birth rate is total live births per 1000 mid-year population. Live births per 1000 mid-year population. How many are the live births? 180. Out of how many population? 10,000. Okay, so very simple. It is your 18 per 1000 population. अब यहाँ पे see 18, this could be the answer. 6.5, the first is जिस order में पूछा जाए, you have to answer in that order. First did ask a birth rate, so again this is not the correct answer. 180 not, because birth rate is per 1000 population, so this is out. 65 is also not there. So if I don't calculate my death rate, it is, my answer is already done, and that is option number A. It is 18 and 6.5. What is the crude death rate? Number the death per 1000 population. And again 65 deaths per 10,000, so 6.5 per 1000 population. A lady has given birth to 3 live children, one male 10 years, female 5 years. So again alabala the big question, what is the correct about the demographic indicator? Quickly see the choices TFR, GRR and NRR. ठीक है, 3 चीजें पूछिए, जहां पे भी big question हो, see the last 2 lines choices, तो आपको पता चल जाएगा कि what they are trying to ask. So quickly remind the definition. TFR is total children born in the family. अब see the question. The lady has given birth to the 3 live children. 3 live children है, तो what is the TFR? TFR is your 3. ठीक है. Now again see the choices. TFR 2 is out. TFR 2 is out. This is how smartly you have to exclude your choices. ठीक है. Exclusion is a very important trick you should all be learning. And this is saving your time. So I'm left with only the 2 choices where the TFR 3. Now one male 10 years, female 5 year alive, but unfortunately her another male child. So how many children? 2 male, 1 alive, 1 died. How many female? It is 1 female. So what is the GRR? The gross number or the girl children born alive. How many girl children born alive? Is 1 only. So my GRR is 1. So even if I am not calculating the NRR, I got my answer because this is a GRR 2. This is how smartly you have to answer your question. So my answer is, it is option number 3, TFR 3, GRR 1, and obviously this girl child is alive, so NRR will be 1. So you all had started answering correctly also, and the Dhanush beta, yes, you are very right. That is NRR is, it is 1. So the option, correct answer for this is option number C. Calculate the growth rate of a country with the crude birth rate as 18 and the crude death rate is 6.5. PSM, FMG and the NEET PG, and I said previous year questions, how many times should be done before the exam? At least twice you should see the questions, and again as I say, don't mug up the answers, see the topics. Okay? Now यहाँ पे we have to calculate the growth rate. We know what is a growth rate. Growth rate is always expressed in the percentage. It is a difference between the birth rate minus death rate, but it has to be divided by 10 because birth rate and death rate is per 1000. दिस इज व्हाट इज द फॉर्मूला. बर्थ रेट कितना है? 18 है. डेथ रेट कितना है? 6.5 है. Divided by 10, so it is 11.5 by 10 and it will be 1.15%. ठीक है. अब यहां पे see, those who are answering as option number A. Now beta, you are correct. It is 11.5 per thousand or it is 1.15%. Both are correct. But अगर question में they had answered asked as per thousand, then you have to answer this as your correct answer. But अगर question में mention नहीं है as per thousand, so best way to represent is as percentage. ठीक है, यहाँ पे ध्यान रखना कि what they are trying to ask in the question. अगर उन्होंने question में पूछा है per thousand, then you have to answer as per thousand. If they didn't ask as a per thousand, then what is the standard protocol is the growth rate is always expressed as a percentage. ठीक है, so your best answer over these two will be 1.15%. ठीक है बेटा. How much time is left? I think beta will be finishing in another 30-35 minutes. Calculate the sex ratio for a population where the ratio for the girls to the boys at birth is 50-50. So equal है. So we know that what is the sex ratio? Number of the female per 1000 male. अगर equal है ratio, so the sex ratio will be 1000. Because अगर गर्ल्स ज्यादा हैं it will be more than 1000, अगर गर्ल्स लेस हैं तो less than 1000 है. So यहाँ पे it will not be a 500. ये याद रखना. ठीक है, 500 नहीं है. Not thinking like as a 500 equal है. ठीक है, number of the girls are same as the boys and it is always expressed as a per 1000 boys. So you all are answering quite correct. Here the sex ratio is 1000. 500 women used a new contraceptive for 12 months and reported pregnancies are 5. Calculate Pearl index. Again, what is the Pearl index calculation formula? Accidental pregnancies. How many are the accidental pregnancies? Are 5. Okay. Now divided by month of use. How many women are using? 500 women are using for how many months? Directly they had given me the months. Agar years hota, then I have to convert into months. So directly they had given me into months. यहाँ पे the catch is, what is your multiplying factor is 1200. ठीक है, क्योंकि Pearl index is per 100 women year or per 1200 month of exposure. So this is 0 gone, 5 gone, 12 gone. So it is 1 is your Pearl index. And yes, you all are answering quite correct. A big clap for all of you. That Pearl index for this situation is 1. Mr. X celebrated his 68th birthday. So question is again ala bala big question. Calculate the dependency ratio. What is the formula for the dependency ratio? So dependency ratio is non-working to working. Non-working क्या है? Less than 15 years plus more than 65 years divided by working, that is 15 to 65 years. So the catch is, in the given question you have to find out which is working, which is non-working. Mr. X is 68. It is non-working. His wife, who is 5 years younger. So what is the age of the wife? A wife is 63 years. So she is working. 35-year-old son working. 34-year daughter-in-law working. And the grandchildren 8-year and the 6-year non-working. So how many are the non-working? 1, 2 and 3. So 3 are the non-working. How many are the working? That is 1, 2 and 3 is working. So what is the dependency ratio? 3 by 3, that is 1. So yes, you all are answering quite correct. The 1 is your dependency ratio. Beta, it is not a 0.5. ठीक है, 0.5 नहीं है. 3 by 6 क्यों ले रहे हो बेटा आप? 6 तो टोटल है, टोटल नहीं कर रहे हैं हम. वर्किंग कितने हैं? वर्किंग मतलब जो 15 to 65 के बीच के हैं. 15 to 65 के बीच के तो 3 only working. This is working, this is working and this is working. So it is 3 only working and 3 non-working. ठीक है, it is not that is non-working by the total population. Okay, so here the dependency ratio will be 1. In a city with a population of 1 lakh, the children below 7 years are 25. It was reported after survey that 40,000 male and 20,000 female are literate. Calculate the literacy rate. अब यहाँ पे catch है, what is the definition of the literacy rate? So literacy rate is defined as the literate people. How many are the literate people? The 40,000 male and 20,000 female. So 60,000 are the literate people. अब यहाँ पे the catch is the denominator is total population or 7 years plus. So it is 7 year plus. So 7 years से below कितनी population है? 25%. So this is the catch is total population कितना है? 1 lakh. So less than 7 year, it is your 25,000 population is less than 7 years. So how much is left for more than 7 years? It will be 75,000. So more than 7 year is 75,000. So this is the catch कि denominator में you will not be taking the total population, you will be taking population of 7 years or more. So denominator में it will be 75,000. ठीक है, it will be 75,000 and yes, if I have to make the calculation, that is 60 divided by 75, it is coming as 0.8 or it is 80%. So yes, you all had started answering correct. So yes beta, I don't know the name, your ID is the user TG. So yes, you are quite correct. It is your 80%. And yes Dhanush, you are also correct. That is 60 by 75. So obviously the answer is 80%. In a city, eligible couple contributes the 15% of the total population. 40% of this are using the condom. So what they are trying to ask is couple protection rate. Now couple protection rate means percentage of the eligible couple who are using the contraceptives. Okay, so you should be knowing the definition. Now how many couples are using contraceptives? The 40 are using the condoms, 20% are using the OCPs, 10% are using the copper T, and the 10% are using the other methods. So how many percentage are using? 60, 70 and 80. So 80% of the eligible couple are using the different methods. So if you don't go with the actual calculation ki like total में से पहले आप 50% निकालोगे that who are the eligible couple and then you have to calculate the each of them one by one. No, smartly they'd already given you the these percentage are using and this is what is the couple protection rate. So a shortcut for this is that your answer is 80% is the couple protection rate. So 80% of the eligible couple are using the different methods. So these are the questions from your demography and contraception. We know that while doing this study, you all must be tired, but you have to finish your targets, what you had decided for that particular day. So don't stop when you are tired, stop when you are done. Okay. Now coming to the next important topic, prevention in the pediatric and obstetrics, and here they ask us to calculate the maternal mortality rate, infant mortality rate or neonatal mortality rate. In a population of 50,000 and this is the question is calculate the maternal mortality ratio. MMR अगर mention किया है, it means it is a ratio. What is an MMR? Maternal deaths per 1 lakh population, per not 1 lakh, per 1 lakh live births. ठीक है. अब यहाँ पे I have to find out how much is the live birth and how much is the maternal death. Total population is 50,000. I am not concerned with the total population. Forget this. Total live births are 5,000. So this is a one important figure I will be using. Maternal deaths. Will you consider PPH as a maternal death? Yes. Will you consider eclampsia as a maternal death? Because any death which is related to the pregnancy or aggravated by the pregnancy, yes. Rupture uterus, yes. Snake bite, no. Okay, so this one first important catch. So total maternal deaths are 3 plus 1 plus 1. The 5 are the maternal deaths. This is a first catch. Okay. डिनोमिनेटर में क्या आएगा? आपका लाइव बर्थ्स आएगा. दिस इज अ सेकंड कैच. एंड मल्टीप्लायर क्या है? इट इज योर 1 lakh. ओके, सो 30 गॉन, 55 गॉन. सो योर आंसर लेफ्ट इज 100. सो यस, यू ऑल आर वेरी राइट. इट इज 100. ठीक है. अब यहाँ पे मिस्टेक क्या कर सकते हो? इफ यू आर इंक्लूडिंग this snake bite as a maternal death, your answer will be 120. That is the wrong answer. If you are taking 50,000 as your denominator, your answer will be 10 or 12. That is a wrong statement. ठीक है, तो total population नहीं लेना, you have to take live births. Calculate the number of the total pregnancies in a sub-center with a crude birth rate of 15 per 1000 population. यहाँ पे a very important cat, this is also one of the PYQ which has been asked is, they had given me the birth rate, but what they are asking is the total pregnancies at sub-center. This is the catch. यहाँ पे two step, sub-center का first you should be knowing the population, it is 5,000. So you have to first find out how many will be the birth rate in the 5,000 population. 1000 में 15 है, तो 5,000 में the live births कितना हुआ? It is 5 times of the 15. That is 75. This is the first catch. Second is, total pregnancy में क्या करना है? You have to add 10% extra. So 75 में you have to add 7.5 extra and your answer is 82.5. So the correct answer is 82.5. ठीक है, तो यहाँ पे दो कैच है. One is you have to first find the live births in a 5,000 population and then you have to add a 10%. अगर आपने directly 15 में add कर दिया 10%, your answer will be 16.5. This is a wrong answer because first you have to calculate the total live births in your the sub center. ठीक है, so if you are answering as 16.5, it is a wrong statement because convert the live births in sub center. If you are answering as option C, it is again wrong because you have to add 10% extra to get your total pregnancies. So I hope now it is clear to you. So those who are answering as option number B, it might be clear that you have to convert into the live births in the sub center for 5,000 population. How many antenatal women registered in the antenatal register? Now we know half of the total pregnancies are registered at a time in the antenatal register. The lady health visitor visited a sub center where reported birth rate. ठीक है, तो यहाँ पे 3 कैच हैं. ठीक है, मैंने हिंट दे दिया. सेम जो प्रीवियस क्वेश्चन का था, the same catch is they are asking at the sub center the reported birth rate is 20 per 1000 population. So how many antenatal women registration is found? So first you have to find out, so what is the birth rate? It is 20 per 1000 population. So how many will be the live births at the sub center? 5 times of this, it will be 100. How many will be the pregnancies at 10% extra? It will be 110. Then half of these pregnancies, the antenatal registered will be half of this 110, it is 55. So yes, you are answering correct. That is option D. ठीक है बेटा? Why you are putting a question mark on option C? Because it is the C जो है आपका, आपने जो हाफ किया बेटे, वो हाफ आपने लाइव बर्थ्स का किया. आपको पहले लाइव बर्थ से टोटल प्रेगनेंसीज निकालना है, 10% ऐड करो एंड देन उसका हाफ लेना है 55. सो द करेक्ट आंसर हियर इज इट इज 55. ठीक है, अब सी आगे मिस्टेक क्या हो सकती है. अगर आपने सिंपल 20 को मान के चला लाइव बर्थ से, इसका हाफ लिया तो आपका आ गया 10, ये रॉन्ग है. अगर आपने उसमें 10% ऐड भी करा देन इट विल बी कमिंग एज 11, ये भी रॉन्ग है. अगर आपने सब सेंटर में कन्वर्ट कर लिया बट यू हैड नॉट एट द 10% हाफ किया योर 50, दैट इज आल्सो अ रॉन्ग आंसर. ठीक है, अब अगर आपने टोटल निकाल लिया, उसका हाफ नहीं करा एंटीनेटल रजिस्ट्रेशन में, तो 100 और 110 आएगा. सो सी द चॉइसेस are confusing, and this is the beauty of a question, that you should be getting the choices, and that's why we say for making a question is not a difficult task, but putting the choices are a difficult task, because examiner knows कि in which direction you can move. If you are going in that direction, solving a question, and if you are getting your answer, and if it is sitting in the choices, you are very happy that you had just given a 30 seconds, 40 seconds, you get your answer. You will not give a second thought कि भाई आपने गलत किया है या सही किया है. You will mark and move further. ठीक है. So putting a choices, अगर वो choice में नहीं है, then you will think भाई मेरी कुछ गलती हो गई है. Okay. Now the next is calculate early neonatal mortality. Early neonatal means the death between 0 to 7 days. ठीक है. And this is converting into per 1000. अब see the question. Total population is 50,000. 50,000 total population की कोई जरूरत नहीं है. तो जो irrelevant data है, you ignore that data. ठीक है. Reported live births, total births are 2050. अब यहाँ पे कैच है. मेरी डेफिनेशन क्या है? Deaths in 0 to 7 days per 1000 live births. यहाँ पे total births दिया है and still birth दिया है. So what is my total live births? You have to minus the still birth. So it is 2050 minus 50, that is 2000. ठीक है. Now what is an early neonatal period? Already mentioned, early neonatal deaths 40 है. तो बाकी मुझे पढ़ना ही नहीं है कि what is a late neonatal deaths. I am not concerned. Early neonatal deaths कितनी है? 40 है. 40 कितने में है? 2000 में है. So just half of that. ठीक है. 1000 में कितनी होगी? 20 होगी. And that is what is my answer. ठीक है. That is my answer is 20. So you all are answering very correct. अगर आपने you had not deducted this 50, you might be getting your answer as 20. You'll be getting your answer as it is 19.5. That is what is a wrong answer. ठीक है. अगर आपने 2050 ले लिया. If you are including this neonatal deaths also, late neonatal, means you are not calculating the early, you are calculating the neonatal deaths, then you might be getting your answer as 29.2 or the 30. That is what is the wrong answer. ठीक है. तो जो पूछा है, you should be knowing the definition for that. So correct answer, it is 20, but it is not a 19.5. ठीक है. 19.5 नहीं है. Why? Because they had given me the total births. They had not given me the total live births. ठीक है. अगर total live births होता, then it will be a 19.5. तो यहाँ पे words का definite importance है. Next is calculate the infant mortality rate. Infant मतलब 0 to 1 year की deaths है. Again per 1000 live births. ठीक है. अब see the question. Total population 20,000 है. I am not concerned with the total population. Ignore this value. Now total live births is 2020. अब यहाँ पे already they had given me the live births. I am not bothered about the stillbirth. ठीक है. क्योंकि stillbirth is not counted as a infant death. Early neonatal deaths कितनी है? 50. Late neonatal deaths कितनी है? 20. And post neonatal deaths कितनी है? 10. So they all are the infant period. 50 plus 20 plus 10. So मेरी total infant deaths हो गई. It is 80. ठीक है. This is the catch. Stillbirth is not included in the infant mortality. याद रखना. Now this is out of 2020. ठीक है. क्योंकि live birth दिया है directly, not the total birth दिया है. ठीक है. And you have to convert into 1000. So a simple, अगर मेरे को calculation ना भी करना पड़े, अगर 2000 होता, it was 40. It is 2020, it will be a little less than the 40. So my answer will be 39.6. ठीक है. My answer will be 39.6. So beta, again, I just repeat the thing. See in the question whether they are giving us the live birth or they are giving the total birth. पहले क्वेश्चन में हमने देखा था it was a total birth. सेकेंड क्वेश्चन में they had given me the live births. अगर live births दिया है then there is no need to minus the stillbirth. ठीक है बेटा. So those who are answering as C or 40, be very careful. ठीक है बेटा. So yes, Dr. AB, you are right. And black market is, you are right. Himalay, yes beta, I hope now the concept is clear. The Paridhi, I hope now the concept is clear. अच्छा बेटा, ओके ओके, सॉरी बेटा, you had answered for 19.5 for if I take a denominator as 2050, then it is okay. ठीक है बेटा. So these are the questions related to your topic of prevention in pediatric and obstetric. Very soon you will be getting your examination center, and पता नहीं वो कौन सा एग्जाम सेंटर होगा जहां पे आपके जीत की कहानी लिखी जाएगी. ठीक है. So we all wish that you should be getting a lucky examination center. The wife should be very positive of that particular center, and you will all clear your exam. Now questions from nutrition, they are again the concept based questions. Calculate the energy requirement of 32-year female whose weight is 55 kg and who is recently conceived and 4-month pregnant. So 4-month pregnant है and is having the moderate work profile. तो यहाँ पे दो चीजें हैं. Additional calories first 3 months में no calories is required. After that plus 350 calories are required. What is the basic moderate work profile? A catch we had discussed. The sedentary worker 1700 plus 4 21 is moderate, plus 6 27 is for heavy. So moderate worker का कितना हुआ 2100. So 2100 plus 350. So 1700 is for the sedentary worker. This is out. 1700 again this is out. 2100 is a moderate worker calorie. हमारे को 4 month पे extra calories चाहिए. So 2100 plus 350. So this is your correct answer. ठीक है. Those who are answering beta E, that is an additional calories. उन्होंने बोला है calculate the energy requirement, मतलब total energy. यहाँ पे इस क्वेश्चन में यही ट्रैप है. अगर उन्होंने एक्स्ट्रा कैलोरी पूछा होता then the answer will be option E. टोटल कैलोरीज पूछा है तो 2700 plus 350. ठीक है बेटा. Average daily requirement of a vitamin D in an area is 600 international units with a standard deviation of 50. Calculate the RDA value. अब यहाँ पे again the concept base है. RDA is recommended dietary allowance, and we know what the RDA is equal to. RDA is equal to mean plus 2 SD value. ठीक है. Mean plus 2 SD value. And this is already asked question that how much population it is able to fulfill the need. It is able to fulfill the need of say 97.5% population. ठीक है. That's why the average requirement is not preferred. The RDA value is preferred. So यहाँ पे simply आपको mean plus 2 SD value निकालना है. ठीक है. So statistic का it's integration with the nutrition. So actual value is 600 and SD value is 50. So double of this SD 600 plus 100 and that will be your 700. ठीक है. So you all are answering. It is 700. So option beta यहाँ पे थोड़ा सा आपने गलत कर दिया. I am not asking the range of a 97.5%, 5% population. I am asking an RDA value. RDA value में माइनस साइड पे नहीं जाते हैं. ठीक है. वी आर गोइंग टूवर्ड्स एन अपर साइड एंड RDA मतलब मीन प्लस 2 SD वैल्यू. ठीक है. सो दिस इज अ सिंपल कॉन्सेप्ट बेस्ड क्वेश्चन. जो डेफिनेशन है RDA की दैट इज कन्वर्टेड इनटू अ न्यूमेरिकल. कम्युनिटी मेडिसिन में याद रखना अ वेरी स्मार्टली अ स्मॉल डेफिनेशन इज कन्वर्टेड इनटू अ न्यूमेरिकल. तो यहाँ पे सिंपली एग्जामिनर वांट्स टू आस्क यू द RDA वैल्यू. RDA is nothing but it is a mean plus 2 SD that is able to cover the need of 97.5% population. So it is not 500 to 700. ये आपका जो 500 to 700 है ये range है mean plus minus 2 SD. हम minus की तरफ नहीं जा रहे हैं. So the correct answer is option number C. So I hope it is clear to you now. It is 700 international units. Calculate the daily protein requirement of 50 a kilogram. बेटा prudent diet is something different. A prudent diet होता है it is a cardioprotective diet and this is designed after the Framingham heart study. ठीक है. They say that the total आपका जो cholesterol intake है या total energy from the fat है should be 10 to 30%. India guidelines say should be 10 to maximum is up to 10 to 20%. The Saturated fatty acid content should be less than 7%. Unsaturated fatty acid should be the 6 to 10%. ठीक है? So salt intake should be less than 5 gram per day. The cholesterol intake should be less than 100 grams per 1000 calories. ये prudent diet है. ठीक है? यहाँ पे 100 कहाँ से आया बेटा? क्योंकि मीन प्लस 2 SD होता है, इट्स RDA वैल्यू, एंड स्टैंडर्ड डेविएशन वैल्यू कितना है? 50 है, तो डबल ऑफ 50 इज द 100. ठीक है बेटा? 90 97.5 की रेंज भी सेकेंड ही SD होती है. यस बेटा, इट इज प्लस जो 2 SD है, इसीलिए इट इज एबल टू फुलफिल द नीड ऑफ अ पॉपुलेशन बिलो दैट पॉइंट. ठीक है बेटा? सो Ayusha, thank you beta, that if you have seen me live and you had joined the class. Thank you beta. God bless you. The daily protein requirement of 50 kg person. We know how much is the daily protein requirement is 0.83 gram per kg of the body weight. ठीक है? अब यहाँ पे 1 kg होता तो 50 होता. अब 1 kg 0.83 है तो 50 से कम होगा. अब ओनली यहाँ पे कैच है कि whether this is a gram or milligram. एक छोटा सा कैच है, लेकिन कभी कभी वहां पे कंफ्यूजन हो जाता है. सो ऑलवेज प्रोटीन याद रखना, इट इज अ मैक्रोन्यूट्रिएंट. ठीक है? प्रोटीन, फैट्स, फाइबर्स एंड कार्बोहाइड्रेट. सो इट इज नॉट इन मिलीग्राम्स, इट इज ऑलवेज इन ग्राम्स. सो योर आंसर इज, अगर मैं कैलकुलेट ना भी करूं, सो माय आंसर इज स्मार्टली आई कैन गेट माय आंसर इज दैट इज 41.5 grams, not the milligrams. ठीक है? D will be the correct answer if the range is asked. Yes, if they are asking the range as a plus minus of the 2 SD, yes, so then in that case it will 500 to 700 will be the answer. ठीक है बेटा? एग्जाम के 17 दिन बचे हैं. ठीक है? 17 days are left. फिर वो 28 जून का दिन आएगा, आपका एग्जाम हो जाएगा. Then after few days your result will be out, you all will be passed and your juniors will be behind you. भैया, दीदी, बता दीजिए आपकी स्ट्रैटेजी क्या थी. सर, मैम, हाउ डिड यू क्लियर द एग्जाम? और सारी दुनिया आपको सैल्यूट मारेगी और आपकी कहानी सुनेगी, सुनाएगी, सुनने की कोशिश करेगी. ठीक है बेटा? तो कुछ दिन की मेहनत और है, फिर पूरी जिंदगी सुनहरी है. Now coming to the questions from environment and health, and again these are the concept based questions. In Horrocks separators, the fourth cup onwards the color change is noted. Calculate the amount of the bleaching powder. Very simple question. The amount of the bleaching powder we can calculate as n into 2, and this is equal for 455 liters of water. So simply they are asking for the 455 liters. Fourth cup onwards है, so 4 into 2, so कितना हो गया? That is 8 grams of bleaching powder will be required. A simple question. अगर यहाँ पे ध्यान रखना, कैच अगर है, if they had increased the amount of water, then you have to increase amount of bleaching powder. These are the two indices not very commonly asked, but I thought let me include because it is one of the part of calculation. Brutii index. This we had discussed in the international health about the quarantine of yellow fever guidelines. Aedes aegypti index and the Brutii index. B for the, we had remembered the catchy words, B for the breeding sites. ठीक है? कितनी positive breeding sites हैं and divided by कितने houses examined है. ठीक है? कितने houses examined है. So during the yellow fever surveillance activity, by examining 1000 houses, total 20 Aedes mosquito breeding sites were detected in 5 houses. Number of the houses we are not concerned. How many breeding sites? Because Brutii index is a breeding sites. So 20 breeding sites were detected out of the 1000 houses, and obviously we have to convert into percentage. So multiply. Question is Aedes aegypti index. Aedes aegypti double A means double houses. What we had remembered as a catchy word means positive houses divided by houses examined. Positive houses divided by houses examined. So, yellow fever surveillance activity, 1000 houses were examined. 20 Aedes mosquito breeding sites. I am not concerned with the breeding sites. And the detected in 5 houses. So how many are the positive houses? 5 positive houses out of 1000 houses examined, and convert into 100 as the percentage. So your answer will be 0.5%. Okay. So Aedes aegypti, double houses, positive houses examined, and Brutia index B for the breeding sites. So correct answer is 0.5%. So these are the questions from environmental. Now, just say many of you are asking that how many questions will be asked numericals in the exam, or how many questions will be asked from this topic. Beta, this is beyond my control, beyond your control. Nobody knows that how many questions will be asked from which topic. तो क्यों उसके बारे में stress करना? So you just take a pledge today that I will not stress over the things which is beyond my control. कोई control नहीं कर सकता बेटा कि किस टॉपिक से ज्यादा क्वेश्चंस होंगे, किससे कम होंगे. सो what is only left is that you have to do your work, and what your work right now is focus on your studies. Coming to the numericals from the diseases, yes, very commonly they ask about the case fatality rate, secondary attack rate, and some of the malaria indices. Okay. Then calculate the annual parasite incidence. Again, these are the concept based questions. You should know the definition of those indices of malaria. Annual parasite incidence. Annual parasite incidence, or what is an API, is new malaria cases per 1000 population. How many is the population? 10,000. How many are the new malaria cases reported? 5. So 5 cases reported per 10,000 population. So obviously, how many will be per 1000? It will be 0.5 per 1000 population. Okay. So 0.5 per 1000 population. So यहाँ पे याद रखना कि this is 0.5 is not percentage, because यहाँ पे we are calculating into 1000. This is only the catch, that it will not be a 0.5 percentage, it is 0.5 because it is per 1000 population. तो ये हमेशा याद रखना, whether they are asking as a percentage, they are asking as a per 1000. In a population of the 10,000, slides are prepared. What they are asking is annual blood examination rate. Annual blood examination rate means number the slides prepared per 100 population. ठीक है, so कितनी slides बनाई divided by the total population into 100, because it is in percentage. What is the total population? 10,000. How many slides are prepared is 500. So slides prepared is 500. Out of how much of population is 10,000. So convert into percentage. 0 gone, 0 gone. So it is your 5%. यहाँ पे very careful about your 0. ठीक है. अब यहाँ पे again the catch is that if they don't mention per 1000 or 1000 or 100, rate is expressed as percentage. So 50 per 1000 is also a correct answer, and 5% is also a correct answer. But if they didn't mention, then the best answer will be your 5%. ठीक है. तो ultimately आपको definition strongly याद होना चाहिए, formula strongly याद होना चाहिए, and उनका concept कि how to apply that information in the formula. And that's why those who are answering option A, it is not correct here, because उन्होंने per 1000 नहीं पूछा, and examination rate is expressed as percentage. ठीक है बेटा. Again, slide positivity rate. These are all the malaria indices. So go through the indices again. Slide positivity rate is, it means positive slides divided by slides examined. How many slides you had examined, and उसमें से how many slides are positive into 100, because again it is in percentage. So in the population of 10,000, यहाँ पे total population की जरूरत नहीं है. Out of the 500 slides prepared, how many are positive? Only 5 were positive. So 5 slides positive out of 500 slides which are prepared into 100. So it is your 1%. ठीक है, so slight positivity rate is 1%. So yes, you all are very right. It is 1%. ठीक है बेटा. Again, this is a concept based question. Calculate the amount of the human anti-rabies immunoglobulin for a 50 kg person. We know that how much is the dose of human anti-rabies immunoglobulin? It is 20 international unit per kg of the body weight. Animal होता तो 40 है, human है तो 20 है. Human पूछा है तो 20 है, 50 kg weight है. So how much will be? 20 into 50 and that is your 1000 international units. ठीक है, very simple question. So very good, you all are answering quite correct. That is option B. So Dhanush, a big clap for you. And that is 1000 international. अब यहाँ पे जरा सा भी जीरो का गड़बड़ कर दोगे तो आपका जो है वो 100 भी हो सकता है. अगर आपको एनिमल का याद रहा 40, your answer may be 2000. So be very careful. A calculate amount of ORS required for a 10 kg baby. So ORS amount, 10 kg baby, coming to the clinic with 6 to 8 loose motions, baby vitals are stable and accepting oral. So we know that how much is ORS required? It is 75 ml per kg of the body weight. कितना body weight है? हाँ, 10 kg है. So how much will be total required is 750 ml. Now यहाँ पे it will not be a 1000. अब catch क्या आ गया कि 750 ml जो है आप 4 hours में दोगे या 6 hours में दोगे. So ORS का याद रखना, amount of the ORS is to be given in 4 hours and IV fluid is given in 6 hours. ठीक है, so the best answer is 750 ml to be given within 4 hours. ठीक है, 6 hours में IV fluids देते हैं. Calculate the amount of IV fluid. IV fluid अब कितना जरूरत होता है? The straightforward concept is it is 100 ml per kg of the body weight to be given within 3 to 6 hours. ठीक है, IV fluid 3 to 6 hours में देते हैं. कितने बेबी के लिए चाहिए? 10 kg बेबी के लिए चाहिए. Reported to the clinic, baby vitals are unstable and baby is drowsy. So 100 ml है for the 10 kg baby. So total कितना हो गया? It is 1000 ml and 1000 ml कितने hours में देते हैं? 3 to 6 hours में. So here choices में 6 hours है. So it is 1000 ml. So 750 out because 750 आपका जो है वो ORS के लिए है. ठीक है, अब 4 hours is out. It is to be given in 6 hours. तो ये याद रखना, बेसिक है. ORS जो देते हैं 75 ml per kg to be given in 4 hours sip by sip and IV fluid it is 100 ml per kg to be given in 3 to 6 hours. First loading dose देते हैं आपका and then उसके बाद में we will be giving the remaining dose. ठीक है. Now calculate the BMI of a girl with a weight of 50 kg and height of 150 centimeters and comment on its obesity. So यहाँ पे सबसे पहले आपको दो क्वेश्चन पूछे हैं यहाँ पे. First you should be knowing the BMI and then you should be knowing the range of the BMI. BMI का फॉर्मूला क्या है? It is weight in kilograms divided by height in meter square. Weight कितना है? 50 kg. Height दिया है सेंटीमीटर्स में, so convert into meters, that is 1.5 into 1.5. ठीक है, so I'll be using the calculator and your weight is 50 kg. 1.5 into 1.5 is 2.25, so divide this by 2.25 and this is coming as 22.2. ठीक है, so my BMI is, it is 22.2 and I know that it is less than 25. So it is your normal. So yes, you had started answering. A is a correct answer. A big clap for all of you that you know the formula, you had calculated and you know that it is normal or abnormal. 25 to 30 overweight, 30 plus it is obesity. Calculate the case fatality rate. हमने पहला क्वेश्चन डिस्कस किया था प्रोपोर्शनल मोर्टेलिटी, फिर डिस्कस किया क्रूड बर्थ रेट, डेथ रेट, तीसरा है केस फैटेलिटी रेट. सो वी हैड ऑलरेडी डिस्कस द फॉर्मूला. केस फैटेलिटी रेट इज डेथ्स बिकॉज ऑफ द केसेस डिवाइडेड बाय द टोटल केसेस. ठीक है, फूड पॉइजनिंग आउटब्रेक में 75 वर अफेक्टेड, 50 were hospitalized and 2 died. How many deaths are there? 2. अब यहाँ पे कैच है कि टोटल केसेस आप 75 लोगे या जो हॉस्पिटलाइज हैं वो लोगे? नो, hospitalized is a severe cases are hospitalized, but cases are actually 75. So I'll not be taking this 750 as my denominator. I'll be taking 75 as my denominator. This is the catch. Okay, and multiplied into 100. So it is 3 by 4. So 8 by 3. 8 by 3. So it is somewhere as 2.7%. Okay, 2.66. Yes, it is nearest value is 2.7%. Calculate secondary attack rate. Okay, so case fatality rate, secondary attack rate, proportional mortality rate, very commonly asked question. यहाँ पे formula is very important. Secondary attack rate means secondary cases divided by susceptibles. ठीक है, and this is an important catch. Total कितने बच्चे हैं? 60 children. 20 are vaccinated. आपको vaccinated exclude करने हैं. So 60 minus 20, how many left is 40. First case on the 1st December. So this is a primary case. You have to exclude the primary case. So 40 minus primary case is 39. Out of these 39, 26 more developed measles on the 14th December. Single incubation period में है. ठीक है? So these are the secondary cases. So how many are the secondary cases? 26. How many are the susceptible? That is a catch. It is not 40, it is not 60, it is 39. ठीक है? So 39, 26 by 39. Yes, you are very, very correct. And you all had started answering quite correct. It is 66.6%. अगर आपने यहाँ पे 40 लिया, your answer will be 66%. This is wrong. ठीक है, अगर आपने ये जो फर्स्ट केस है इसको भी यहाँ पे इंक्लूड कर लिया 26 में 27 लिया, your answer will be 67.5. This is also a wrong answer. ठीक है, so be very careful. Again, this is not very commonly asked question, but as I found this concept, so I thought I should take this as a numerical. Calculate the microfilaria percentage. Microfilaria means percentage of the individuals having microfilaria in their blood. मतलब जितनी slides you had examined, out of that how many are positive. So during the transmission assessment survey, a population of 10,000, 1,000 slides were prepared. So we will not take this total population. How many slides prepared? मतलब एक तरह से जो मलेरिया की स्लाइड पॉजिटिविटी रेट है ना, द सेम इज एज अ माइक्रोफाइलेरिया रेट. ठीक है, आप इस तरह से कैची वर्ड याद कर लो. 1,000 slides were prepared and 5 were found to be positive. So microfilaria is how many positive slides for microfilaria? How many slides examined is 1,000 multiplied by 100. ठीक है, multiplied by 100. So 0 0 gone. So yes, you all are quite correct. It is your 0.5%. ठीक है, so it is almost the same as slight positivity for malaria is microfilaria. Means how many percentage of the individuals are having microfilaria in their circulation. Again, this is a concept base, and it is your TB indicator, that is ARI. ठीक है, we discuss मलेरिया का API है annual parasite incidence and TB का है annual rate of infection, and this is a standard value that अगर 1% ARI infection is at present, future में there is a possibility of the positive TB cases will be 50 per 1 lakh population. ठीक है, this is a standard fixed value. अगर current ARI of a country is 1%, future में positive TB cases will be 50 per 1 lakh. So what they are asking is number of the active sputum smear positive cases in future if a new TB infection rate is 2%. अगर 1% है तो 50 पर लाख होगा, अगर 2% है तो डबल हो जाएगा, दैट इज 100 पर 1 लाख पॉपुलेशन. ठीक है, तो यहाँ पे कोई फॉर्मूला नहीं है, इट इज अ फैक्ट बेस्ड क्वेश्चन है कि 1% ARI करेंटली इट मींस फ्यूचर में 50 स्पूटम पॉजिटिव केसेस पर 1 लाख. So here it will be 100 per 1 lakh. ठीक है? You all are going to win this race, and whatever mistakes if you are doing, don't be upset with that mistake. You just go on correcting those mistakes, because you are not going to stop at any moment. You have to just move on, because winners never stop trying. You should go on trying. You should go on correcting your mistakes. Okay. Now, the last area from where the questions are is, that is concept of health and disease. Okay. This is again the fact based questions. Calculate the PQLR of a country. Again, not very commonly asked, but I thought let me just include this. PQLI of a country with a given parameter. आपको यहाँ पे बेसिक कॉन्सेप्ट क्या याद रखना है कि PQLI का कैलकुलेशन होता है, इट इज अ अरिथमेटिक मीन, सिंपल आपको एवरेज निकालना है. ठीक है. सो 3 पैरामीटर्स हैं, लाइफ एक्सपेक्टेंसी एट 1 ईयर, लिटरेसी रेट एंड IMR. So what is an IMR? 25. What is life expectancy? 80. And what is literacy rate? It is 80. And 3 parameters hai, so divided by 3. So it is 160 and 185 divided by 3. So I'll be using my calculator. That is 185 divided by 3, and it will be coming as somewhere as 61.66. ठीक है. So it is 61.6 is it is your correct answer. ठीक है. तो PQLI मतलब सिंपल आपको जो एवरेज निकालना है. Now this I expect that you should be knowing, because it has been asked in the NEET PG, one of the exam. Calculate the life expectancy index. अब यहाँ पे HDI के लिए if you remember we had discussed that it is calculated as a geometric mean. Means for every parameter you have to calculate the index and then multiply the index, take the cube root. It is a quite difficult, but index का formula आपको पता होना चाहिए. Index is, it is the actual value of a country minus minimum value globally divided by maximum value minus the minimum value. ठीक है, ये index का formula है. Now calculate the life expectancy index for India. India का life expectancy क्या है? Actual value of India is 70. What is the global minimum life expectancy? 20. What is the global maximum life expectancy? 85 minus 20. ठीक है. So it will be your 50 divided by 65. 50 divided by 65. So let me use the calculator. 50 divided by 65 and that is 0.76. ठीक है. अब यहाँ पे परसेंटेज में नहीं जाएगा, बिकॉज HDI का we know the range is, it is 0 to 1. Okay. So the correct answer for this is 0.77. ठीक है. Again, this is a higher level question, not asked till present in the FMG exam. Calculate the DALI for the person. An old person died at age of 85 years and after the prolonged suffering of paraplegia for the last 10 years, calculate the DALI. Again, a concept based question. What is the DALI? Disability adjusted life years. The years lived in the disability. How many years he lived in the disability for? 10 years. So, 1 DALI is equal to 1 year. So, answer is not the 75, either 10 or 10 years. It will not be years. ठीक है. So, यहाँ पे यही catch है. So, your answer is DALI 10. It is not the 10 years. ठीक है बेटा. So, Dhanush बेटा, it will not be 10 years. It will be written 10 years तक paraplegia था, but the DALI अगर count करेंगे, it will be written as 10 only. ठीक है बेटा. Now, coming to the last question, that is again one of the PYQ. Calculate the standardized mortality ratio. Now, standardized mortality ratio, it is the observed deaths divided by the expected deaths into 100. ठीक है, दिस इज द मेथड ऑफ स्टैंडर्डाइजेशन, इनडायरेक्ट मेथड ऑफ स्टैंडर्डाइजेशन, ठीक है। अगर आपको एज स्पेसिफिक डेथ रेट इज नॉट अवेलेबल इन दैट एरिया, देन यू कैन यूज द इनडायरेक्ट मेथड. Now, lung cancer rate in Delhi NCR reported as 5 per 10,000 population, as the most individuals are exposed to the risk of air pollution. So, actual value observed deaths kitni hai? 5 per 10,000, while the expected lung cancer rate is 2.5 per 10,000. So, observed death kitni hai? It is 5. Expected deaths kitni hai? 2.5 multiplied by 100. So, your answer will be 200. ठीक है, आंसर विल बी 200. ठीक है बेटा. अब आपने जो है अगर उल्टा कर दिया तो सी धनुष बेटा, आपने फॉर्मूला को उल्टा कर दिया. इट इज नॉट एन एक्सपेक्टेड डेथ डिवाइडेड बाय ऑब्जर्व. अगर एक्सपेक्टेड बाय ऑब्जर्व होगा तो आपका 50 आएगा. यहाँ पे क्या है? ऑब्जर्व डेथ डिवाइडेड बाय एक्सपेक्टेड डेथ है, सो इट विल बी 200. ठीक है, सो दिस इज ऑल फॉर टुडे. एंड इन द लास्ट आई विल से कि अपन का टाइम आएगा नहीं, अपन अपनी मेहनत से खुद लाएगा. ठीक है, और अपना टाइम अपन खुद लाएगा और अपना टाइम अच्छा वाला टाइम अपना लाएगा कि एक विनिंग सर्टिफिकेट, पासिंग सर्टिफिकेट आपको मिलेगा. ठीक है, तो किसी ने सही कहा है, मन के हारे हार है, मन के जीते जीत. अगर आपने ये अभी से मान लिया कि नहीं मेरे से नहीं हो रहा है, मैं नहीं कर पा रहा हूं, तो वो थॉट नेक्स्ट 17 डेज के लिए बच्चों निकाल दो. ठीक है, आप इतनी मेहनत कर रहे हो, यू हैव टू जस्ट बिलीव इन योरसेल्फ. सब अच्छा होगा, सब अच्छा होगा. ठीक है, कैलकुलेशन कैसे होगा बेटा? देखा ना अपन ने कि कैलकुलेशन सिंपल है, कैलकुलेशन से डरना नहीं है. ठीक है, एंड कैसे कैलकुलेशन होगा इसके लिए और आपके लिए आई एम जस्ट प्रोवाइडिंग ऑल दीज फ्लैश कार्ड्स, जहां पे I had just summarized all the formulas, all the various indexes, all the various rates, ratio, definition in a single page. So these 5 pages are very important. Okay, those who attended my live classes already they are having these flashcards, but those who had not attended my live classes, I just request all of them to just download the flashcards or save these flashcards and just revise them the day before your exam. तो आपको न्यूमेरिकल्स पे फोकस नहीं करना है, आपको सिर्फ फॉर्मूलाज पता होना चाहिए, आपको डेफिनेशंस पता होना चाहिए कि कौन सी वैल्यू वी हैव टू एक्सप्रेस इन 100, कौन सी वैल्यू वी हैव टू एक्सप्रेस इन 1000, बिकॉज दिस इज अ वेरी इंपॉर्टेंट कैच इन द कैलकुलेशन. वैल्यूज तो कुछ भी हो सकती है, न्यूमेरिकल में वैल्यूज इज चेंजिंग, द न्यूमेरिकल इज चेंजिंग. सो यू आर नॉट गोइंग टू मग अप द आंसर्स, you are not going to mug up the numerical, you are just going to mug up the definitions and the formulas. ठीक है, so this is very important. And in the last I can say you all can do, you all can do, and good luck to all of you for your exam. ठीक है, so let me see if there is any question. The last December exam में did the exam but I got an so revised because of this. बेटा जो हो गया पास्ट में हो गया, then you are a big warrior. At least you had faced the problem and now you are back. So I will salute your courage and all. So definitely जो आपका courage है और जो आपकी knowledge है, अगर पॉजिटिवली आप उसको ऐसे ही लेते रहेंगे, सो डोंट थिंक अबाउट द जनवरी 2027. आई थिंक यू विल क्लियर इन द जून इटसेल्फ. ठीक है बेटा, ठीक है. सो PYQ बायस्ड हमेशा रिमूव करना है, रिमेंबर दिस पॉइंट. ठीक है बेटा, yes बेटा, ये PDF जो है you will be getting in the description link of this video, so you will be getting the PDF, don't worry. ठीक है बेटा, so bye bye, God bless you. So I'm closing.